So for my last redo for this week, I am doing my nasopharyngeal suctioning over again. So I'm practicing my sterile here. I've checked my doctor's orders, making sure my patient has orders to be suctioned. She does. So I've already let my patient know what it is that we're going to be doing. I've let her know that we're going to be suctioning her. She's a little bit not feeling good right now. Her O2 sats have dropped. She's been sitting at like an 88. Her lung sounds, I hear a lot of wheezing and rhonchi in there. So we're going to go ahead and suction her. I've got my sterile kit here. I've got my sterile water. For my previous video, I already have the water poured, so I will just talk through the part where I take my box out and set it up. But I've checked my expiration date. It has been used within the last 24 hours, so I can still use it. But before I go ahead and use it, I'm going to lip the top. So I'm lipping it. I've lipped it, and I'm going to go ahead and take my box out of my kit and put it here, open it, and pour some of my sterile water in there. Now that I've done that, I can go ahead and get my kit ready. My patient, she's sitting up in a semi-Fowler's position. The head of the bed is elevated so that we can, actually, let's see if I can actually turn it down a little bit more. The head of the bed is elevated so that we can actually help her breathe better. So now that I've got that done, I'm gonna move my patient over. In this video, this is my suctioning, but I'm not gonna hold it in my hand because our catheter doesn't fit in here. It's not meant to fit in here. So it's kind of hard to hold it and keep sterile while doing it. So I'm just gonna simulate me using this and connecting it, and then I'll be done with it for my video so that I don't mess up my sterile procedure. So my suctioning is connected on low intermittent wall suction. I've got that here. So I'm gonna go ahead and open my kit. I would open away from me, and I would go ahead and grab my gloves out. I'm just gonna move my kit over to the side a little bit so that you can see me opening my gloves. I'm gonna open using the 1-inch borders. I'm gonna go in here. Using my 1-inch borders. I'm gonna grab the cuff here, put my gloves on, grab the cuff. Put my gloves on, and then I'm just gonna move this out of our way. Okay, and I can bring my kit on over. I know that my sterile hand is gonna be my right hand, my non-sterile is gonna be my left. So I'm gonna go ahead and grab my catheter out of here. And in my right hand is gonna be this part of the catheter, and this is where I would hold my catheter here. So I'm just going to get that ready and hold this here. Getting this out of the way. I'm going to connect it to my suctioning. This is where I would go, my left hand would go non-sterile. I would connect it to my suctioning. Prior to me doing that, I would go ahead and lubricate the tip of my catheter. So I'm gonna go ahead and lubricate it generously. And then I'm gonna go ahead and connect my suctioning. At this point, I would go unsterile to connect my suctioning, and I would be holding it as such and keeping my hands up above. But for this video's purposes, I'm gonna go ahead and drop this, the blue piece, because it's kind of hard to hold it, try to hold it together while also doing this and suctioning at the same, or actually maybe I can make it work. So I will go ahead and perform my lung assessment. I've already done that. So I'm gonna go ahead and test my suctioning to make sure it's working. And it does. Just gonna have my patient tilt her head up a little bit, and I would insert until about the earlobe and then suction on my way out. So I'm gonna go ahead and do that. I'm gonna go ahead and insert. I would insert until I get some resistance. Now, being mindful, here I am not stopping this up on the way in, I'm doing it on the way out. So as I'm pulling out, go ahead and suction. See, that's what I mean, it's hard. It's hard to do that. Okay, and I would pull out. I would hyperoxygenate my patient prior to doing that using an ambu bag or whatever form of oxygen therapy she's using. So I've hyperoxygenated her before, and I keep jumping right into suctioning without saying that before and correcting myself. But I would hyperoxygenate first, then suction. Once I'm done suctioning one time, I can go ahead and hyperoxygenate my patient again just to help keep her oxygen up. I think she needs a little bit more suctioning, so I've hyperoxygenated her. I'm going to go ahead and suction again after I've cleaned off my catheter. Okay, now I can go ahead and suction again. I'm going to go in. I've got some resistance, so now I'm coming out and I'm going to suction. Okay, and I would oxygenate again, make sure my patient is comfortable, and I would perform another lung assessment. When I'm done with my catheter, I would fold it up in my glove. I'm going to sit this down, and I would dispose of it in my glove. But since I'm going to keep these two gloves, I'm not going to do that. And that'd be it for this video.